Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Integrative Movement Insider. And this is the fourth edition of Integrative Movement Insider for the year 2019. So thank you for joining us. Thank you for allowing us to share this information with you and for being that solution that your current clients need. And hopefully with this information and the information we share with you in this series of Integrative Movement Insider, become that go-to specialist for the clients, your potential clients that need, want, and will pay you for your expertise. Janice and I just got back from Korea where we're teaching the 3-day intensive course, the Integrative Corrective Exercise Instructor Program. And this is an intensive course where we introduce the participants to the Integrative Movement System, the proprietary system that we created to work with our own clients and patients here in our clinic. So we walk them strategically through the functional anatomy, biomechanics, and motor control so they truly understand how the body works, as well as the most relevant research around the core, spine, pelvis, as well as the hip and shoulder complexes. So that way the individuals really understand how the body works, so that way they also then understand how to perform assessments and why to do certain assessments and why certain exercises work versus some exercises that may be contraindicated. So one of the areas of the body we cover, as I mentioned, is the shoulder complex. So we shared with these chiropractors and physical therapists, as well as fitness professionals, how to properly assess a shoulder. Because if you don't know how to properly assess the shoulder, then you're just guessing at the exercises you're using. And some of the exercises will maybe benefit your clients, however, create problems for some of your other clients. So you have to really be sure of what you're giving the exercise for based upon your assessment. So I want to share with you a very simple assessment that we teach as part of the Integrative Movement System assessment process, and that's rotation, shoulder external versus internal rotation. Now, if you know my history a little bit, I developed rotator cuff tears and bilateral labral tears in both shoulders by doing the things I was taught in rehabilitation, in chiropractic college, and even when I went to physical therapist here in Chicago when I first got out of school with terrible shoulder problems. And I got to a point where I couldn't even lift 10 pounds over my head because my arm was so weak and unstable, like my arm would be shaking with a 10-pound dumbbell. So I knew something was wrong, but I didn't know what labral tears were back then. Obviously, I know now. So one of the assessments that I created for myself that nobody really ever looked at, they just gave me a bunch of external rotation work because they said, hey, Evan, you got this forward shoulder position, so just do a lot of external rotation work, do a lot of retraction and depression. So I want to ask you, because I asked everyone that comes through our certification course the same question. Have you ever evaluated internal versus external rotation on your client? And do they really have deficits in internal rotation, or I should say external rotation, and tight, short internal rotators? And if they do, are you doing the most appropriate protocol for them? So I want to show you a very simple assessment that we use with our clients here in our clinic. So we'll just lie down, have our clients just lie down with their arm at 90-90 position. So the shoulders abducted to 90 degrees, the elbows flexed to 90 degrees. Now have the client just bring, this is 0 degrees right here, have the client bring their arm back all the way to the floor or as far as they can get back. And you can see I can get about 90 degrees. And if I was on a table, I'd actually get a little bit more. So that's plenty of range of motion. Now let's look at internal rotation. So come back to the 0 position, which is right here. I'm going to put my hand on the front side of my humerus so I can feel exactly when my humerus starts lifting up off the floor. So I'm looking at pure internal rotation, and that's all I have right there. And if I go any further, then my arm starts lifting up. And for so many of your clients, they actually have deficits in internal rotation, and they look more like my range of motion right there, especially your clients with forward shoulder position. Because that's why their shoulder is coming forward, because they're actually throwing their shoulder forward because they've lost the ability to do internal rotation. So one of the things that we want to do with our clients is then release the appropriate muscles that restrict the ability to get into internal rotation. Those muscles being the external rotators of the shoulder. So supraspinatus to a certain degree, but especially infraspinatus and teres minor, so that your client will restore more of that internal range of motion, rotation range of motion. Then once you've released that range of motion, now you want to go to a release and stabilization type exercise. A release exercise, what I mean by that, is an exercise that will help the individual lengthen the muscles that you just released and then use it in a functional position to teach the individual how to stabilize their scapula and humerus. So we like the supported squat position, I should say the supported hip hinge position and pattern, because it really helps teach the client how to stabilize and also create length underneath their shoulders. So here's how we do it. We can use a wall, we can also do it from the quadruped position. I'll use the bar right here. So first we have a client align their head and neck and thoraco-pelvic cylinder, so stack that thorax over top the pelvis. They're going to hinge, placing their hands onto the bar, or they can have their hands up against the wall as well. Step back, they're going to breathe in from this position and then breathe out as they hinge back, creating that pure rotation of the entire thoraco-pelvic cylinder over top the femoral head or the hip joint, and they're lengthening underneath their lats, so creating separation between the humerus and the scapula. They're going to breathe in to come upright, breathe out, and hinge, creating length underneath the arm. At the same time, I'm gently pushing into the bar that direction, which will help stabilize the scapula upon the rib cage, because that's what the majority of our clients need to create better and more optimal range of motion and ultimately develop the stability they need to functionally load their arm. So this is a great pattern. The supported hip hinge is a great pattern to reinforce optimal alignment and control once you've done your release work, because it helps to develop that upward rotation and posterior tilt to put the scapula on the rib cage where it belongs in this position, which you ultimately need to get your arm overhead, as well as load into functional stability type of position. So great way to get functional length of the lats and those external rotators, and also to promote scapular stability without retracting and or depressing, which is one of the most common causes of neck and shoulder problems. And it's the exact same thing that I got taught in rehab over 20 years ago, to retract and depress. So we do not teach our clients to detract and or depress their scapula. In fact, we teach them to do the exact opposite, is to go wide across their shoulders and wrap the scapula up and around the rib cage, the exact opposite of what we've been commonly taught by rehab professionals, as well as what I was taught in chiropractic college. So this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education, sharing with you some components of the integrative movement system assessment and how we use that information to drive our corrective exercise process. So next week I'll come back and share with you how you start to integrate that, because that's the third step of the integrative movement system approach to posture and movement, is integrating this new range of motion, this new stability that you're helping your client create into the functional pushing and pulling patterns. Because ultimately, you need your client to be able to push and pull in this new alignment with this new mobility you just helped them create. Because that's really how you help marry this information from assessment to corrective exercise to the functional movement patterns, and ultimately tie it into the goals that your client wants to accomplish. So I hope you enjoyed this video. Hope it explained to you how to use your assessments and corrective exercise strategy. And next week, we'll come back and share with you how to integrate it into the functional movement patterns. This is Dr. Evan Osar. Make it a great day. We'll see you next week. And if you're looking for more information, as well as a strategic way of using your assessments, corrective exercise strategy, and how to integrate this information into the fundamental movement patterns that your clients need to do to accomplish their health and fitness goals, then check out the Integrative Corrective Exercise Instructor Program. Janice and I will be in Reston, Virginia next weekend, teaching the first one here in the United States for this year. And we have a couple other locations throughout the year. So check out IIHFE and look up Integrative Corrective Exercise Instructor Certification Program. And we look forward to seeing you at a training this year. Make it a great day. We'll see you next week at Integrative Movement Insider.